Hello guys, welcome once again to our topographic anatomy and operative surgery videos. Our textbook once again is by Anatoly V. Nikolaev, Professor Nikolaev from Russia. All right, I'm your host, Julius Kwedhi, MD, and let's dive into it right away. And right here at the beginning, before we start, let me remind you to like, subscribe, and share the video with your friends and colleagues. All right. So we are continuing with our basic terms, with our basic terminology in topographic anatomy. This is part 2, and as we mentioned last time, we talked about the different layers of the body. You have the skin, which is also divided into the epidermis, the dermis, and the hypodermis, followed by the subcutaneous adipose tissue, which is then followed by the superficial fascia, then followed by the proper fascia, and then that is followed further by the deep subfacial structures, which can be organs, visceral organs, which can be arteries, veins, nerves, tendons, and so on and so forth. All right, so in describing the layers, we always need to start with the skin. Why? Because in different body regions, the layers vary in thickness and characteristic. Now, when we talk about the skin, as I mentioned, you have the epidermis, the dermis, and the hypodermis. And then those are followed by the subcutaneous tissue. Those are followed by the subcutaneous adipose tissue. And then after that, you have the superficial fascia. And then after that, you have the proper fascia. And then after that, you have the deep subfacial structures once again. All right, pay attention that when you are doing surgery, when you're doing the operation, pay attention to the fact that the skin has mobility, is mobile. Therefore, to avoid sliding and the deviation from the constructed projective line of incision, you need to be able to stabilize the skin so that the skin does not move. So be aware of the mobility of the skin. Be aware of the mobility of the skin in the region where you're operating so that you avoid the sliding and deviation from the constructed projective line of incision. Now, another thing to be aware of is the fact that during an operation, you need to take note that if you find skin that is covered with hair, this may indicate staphylococcal infection, which is also known as carbuncles. This is a staphylococcal infection of the hair follicles. Staphylococcal infection of the hair follicles. And when you have many subcutaneous furuncles, when you have many subcutaneous furuncles, then those are termed carbuncles. All right. And also another thing that we pay attention to with respect to hair that may indicate an infection underneath or an inflammatory process underneath is another condition that we are aware of, is a condition that is called hidradenitis or hidradenitis, which happens especially in the axillary fossa, and within the axillary fossa, this happens usually in the sweat glands. And so, what are hidradenitis? Hidradenitis, this is a group of inflammatory diseases. Remember that it's not one disease, it's many types of diseases that involve an inflammatory infiltrate. Inflammatory infiltrates around the sweat glands, also known as eccrine glands, right? One of these hidradenitis that is very famous is hidradenitis suppurativa, also known as acne inversus, which is a chronic inflammatory condition that is deep within the nodules, forming abscesses. You also find draining tracts and fibrotic scars. And hidradenitis is common in intertriginous areas, those areas where there's a lot of folding and different parts of the body are rubbing against each other, and areas that are rich in apocrine glands, all right? Such areas such as the axillary fossa, the groin, the perianal region, the perineal region, around the private parts there, and the inflammatory locations. So hidradenitis, as we said, affects neutrophilic eccrine glands, and there are two types, at least. There are many types of hidradenitis, and here are two more examples: neutrophilic eccrine hidradenitis, as well as recurrent palmoplantar hidradenitis. Okay. Now, let's talk about the superficial fascia and the subcutaneous tissue, also, which I abbreviate as SAT. It is important to take note that where the subcutaneous adipose tissue is loose, in those places, it is very easy for pyoinflammatory processes that form what? PAS. Pyoinflammatory processes and hematomas. As you know, hematomas, this is when a blood vessel bursts, and then blood goes and accumulates under the skin, right? You have a hematoma. You have damage. You have an injury to a blood vessel, thereby forming blood. The blood then exits the blood vessels and then accumulates under the skin. That's called a hematoma. So, in places where the subcutaneous tissue is loose, it is very easy for pyoinflammatory processes as well as hematomas to spread along the width of the subcutaneous adipose tissue, right? And when we mention that, you already have in mind conditions such as cellulitis, right? Cellulitis. All right. Now, in some body regions, the subcutaneous adipose tissue has a cellular structure, and this is because of connective bridles or connective tissues that extend from the skin to the deeper lying organs. All right? What do I mean? For example, as we said, you have your skin, you have the subcutaneous tissue, you have this superficial fascia, and then you have the superficial fascia, and then you have the proper fascia, right? Now, so when you have a hematoma that is formed underneath the skin, yeah, or an edematous process, fluids accumulating under the skin, or you have pyoinflammatory process like cellulitis accumulating under the skin, where you have pus that is forming under the skin, or an abscess of some sort. So in the places where the subcutaneous tissue is loose, so you find that these accumulations, these fluids, or these pyoinflammatory processes, they begin to spread down from the skin to affect the organs that are lying underneath, right? So pay attention of that. This, yes, this is especially in places such as, in places such as the gluteal region, the sole, the palm, and the scalp. All right. And you say, wait a minute, what is in those places? In those places, that's where you find the connective tissues that are connecting the skin with the deeper lying organs. So you have those connective tissues connecting the skin and the deeper lying organs, which allows hematomas, edemas, and peri-inflammatory processes to go from the skin deeper. All right, great. Let us move on to the next point. Now, again, paying attention to our layers of the body, you have the skin, right? And then you have the subcutaneous tissue, you have your superficial fascia, you have the proper fascia, and then the deeper organs, the subfacial organs. Now, within the subcutaneous tissue, that's where you'll find the arteries. That's where you'll find the veins as well as the nerves. They run in the subcutaneous tissue, which is the arteries, veins, and nerves are also known as the superficial. These arteries, veins, and nerves are also known as the superficial neurovascular bundle. Okay. Now, in places like the scalp and regio inguinale, in the inguinal region, you will find large arteries instead of just common small caliber arteries. You'll find large arteries which are designated specific proper names within the subcutaneous tissue. Some veins, it's also important to take note that some veins are accompanied by nerves, whereas some are not. Some are, some are not. Now, let's talk about the proper fascia. Again, reminding us of the layers of the body. You have the skin, followed by the subcutaneous tissue, followed by the superficial fascia, and then the proper fascia. And then beneath that are the subfacial structures. Now, within the proper fascia, this one right here, you'll find the deep facial lamina, you'll find the septa, facial septa, you'll find the facial capsule, you'll find facial interstices that are formed by the lamina and the septa. On the other hand, within the subfacial, below the proper fascia, as we said, you'll find subfacial structures. These subfacial structures are the likes of muscles, visceral organs, and then neurovascular fascicles, or neurovascular bundles, which are beneath. These are all found beneath the proper fascia. Neurovascular fascicles beneath the proper fascia. Now, once you go down now into the deep, into the subfacial organs, subfacial structures, deeper subfacial structures, you'll have to utilize or to be mindful of internal landmarks. You'll have to be using internal landmarks to allow you to position the organs, right, and other structures, because once you go beneath the skin, you can't see there. But as a surgeon, when you're performing, once you get beneath the skin, beneath the proper fascia, because the skin, the organs in the body are not the way they appear in textbooks. They are quite complicated. They are interwoven and all these kind of things. So you need to be able to use certain internal landmarks to allow you to position certain organs and structures. For example, let us zoom in on this picture here. For example, you have the tendon of the Latissimus Dorsi, musculus Latissimus Dorsi, and then you have the humerus, right, the forearm, the upper limb, The Latissimus Dorsi, as we know, musculus latissimus dorsi is one of the back muscles. And then you have, if say this is your arm, right? This is your arm. This is, of course, the neck, the colli. Colli. This is your neck there. And then this is your shoulder. Right? So this is your axillary fossa. So that is your axillary fossa right there. Now, this axillary fossa, we know that posteriorly you have the tendon of musculus latissimus dorsi. This tendon of musculus latissimus dorsi goes and attaches to the humerus. So where the tendon of musculus latissimus dorsi and the humerus meet, they form an angle. This angle, in that angle, that's where you'll find the foramina. That's where you'll find foramina quadrilaterum. Has 4 sides, has 4 angles. We'll look at that later in the respective videos. But this foramina quadrilaterum is one of the very important anatomical landmarks. Within there, you will find axillary nerve. The axillary nerve, you also find the arteria circumflex humeri posterior. So the posterior artery circumflex humeri, right? Arteria circumflex humeri posterior. And the axillary nerve, nervus axillaris, they pass through the foramina quadrilaterum. It's a very important one, especially for the orthopedic guys. Now, when you look at the tendon of musculus latissimus dorsi, at the level of the superior border of the tendon of musculus latissimus dorsi, at the superior border, the level of the superior border of the tendon of musculus latissimus dorsi, at that place, the axillary artery branches off. There is a branch of that artery. That branch is the arteria subscapularis. Arteria subscapularis. So, arteria subscapularis further divides, and then it breaks, and then you have a branch that breaks off there, which is the circumflex scapular artery. Arteria circumflex scapulae. Arteria circumflex scapulae. So this arteria circumflex scapulae that breaks off from arteria subscapularis, arteria circumflex scapulae runs through foramina trilaterum. That's another very important landmark, anatomical landmark, surgical landmark within that region. So you have 2 very important landmarks. You have your latissimus dorsi, you have your humerus, and then at the angle there you find the foramina quadrilaterum, right? And then at the superior border of the tendon of the musculus latissimus dorsi, arteria axillary divides, and then it gives off a branch called the arteria subscapularis. Arteria subscapularis further gives off another branch, which is called arteria scapularis circumflex. Arteria circumflex scapularis. And this artery runs through the arteria foramina trilaterum. Why are we talking about this? Because these arteries, these connections, these will help us later on to understand the anastomosis of arteries. Yeah, blood supply to the shoulder. All right, now let us go on to the abdominal cavity. Talking about our anatomical landmarks, our surgical landmarks, internal landmarks. Now, within the abdominal cavity, you have some very reliable internal landmarks. Which ones? For example, the peritoneal ligaments. The peritoneal ligaments. Now, the for example, the hepatoduodenal ligament, which is a peritoneal ligament. the hepatoduodenal ligament. Once you find that ligament, then behind that ligament you have the omental foramen, foramina omentale. So behind the hepatoduodenal ligament. So once you find hepatoduodenal ligament, that is a landmark for you. You just look behind it, and then you find the omental foramen. Now, deep within the hepatoduodenal ligament, you also find the common bile duct. You also find the vena portae, the portal vein. All right. What else? Talking about abdominal internal landmarks. When doing the surgery for cholecystectomia, once you find the cystic duct as well as the common bile duct, they will help you to locate the cystic artery. All right, so those are some of your anatomical surgical landmarks. Now, again, I remind you of our scheme. You start with the skin, and then number 2 is the subcutaneous tissue, and then the superficial foramina, and then after that you find the proper fascia, fascia proper. And then after that, you'll then find another layer called, now this is a special, now we are describing in the region of the internal cavities. In the region of internal cavities, such as in the pectoral region, in the abdominal cavity, and in the small pelvis, which is also known as the true pelvis. These are the layers you'll find. You'll find the skin, you'll find the subcutaneous tissue, you'll find the superficial fascia, you'll find the proper fascia. Now, these are the standard fascia, on standard layers. On top of these layers, on top of these usual layers, let's say beneath the proper fascia, so this is the top, this is your bottom there, right? Or should I say deep? Yeah. So this is the top of the skin, and then that's deep within the body. So below the proper fascia, within those three cavities, proper peritoneal, abdominal, and small pelvis, you will find additional layers, the osteomuscular or muscular wall. And then after that, when you peel off that layer, then you'll find the next layer called the deep peritoneal fascia. Deep peritoneal fascia, right? Fascia peritoneale profunda, deep peritoneal fascia. And then after that, you'll find the lamina parietalis of the serous membranes. And then after that, you'll find the lamina parietalis. This lamina parietalis, the parietal lamina of serous membranes of the pleural cavity as well as the peritoneal cavity. All right, great. Now, guys, that brings us to the end of our session today, or the end of this video. Don't forget to smash the like and subscribe button and share the video with your friends. Next time we'll come back to you again with another video, continuing with we'll continue with the basic terminologies of topographic anatomy, and we will even look further. We'll even examine further the proper fascia, the superficial fascia, and the cellular spaces. We'll also look at the cellular interstices. We'll look at collateral blood circulation, and then after that we'll look at the operative surgery and operative procedures. All right, take care, guys. Thank you so much for watching till the end. Once again, smash that like button, subscribe, and share the video with your friends. All right, till we meet again. Shalom.